My name is Emilia, and my project is exploring the emerging concepts of sustainability initiatives implemented within institutional food service settings, a scoping review. Institutional food service settings have a significant impact on the environment, hence, effective sustainable practices in hospital and healthcare institution food service settings is important in supporting the ecological sustainability of the food system. Research in this area is necessary to inform the future development of sustainable guidelines, policies, and frameworks. Factors that enable the success of sustainable practices include the improved sustainable education of staff and administrators, dedicated personnel who drive and facilitate change, patient-centered food service models, and sustainable food procurement. Barriers to sustainable practices include competing and inadequate institutional priorities, lack of education, and current food service models and policies. Dietitians and hospital administrators must play a key role in implementing and facilitating changes to promote sustainable practices in these settings. This new and emerging area of research presents a gap in research that requires further study to enhance the environmental sustainability of these institutions and reduce the impact on our available resources. This project will aim to explore the emerging concepts of sustainability initiatives that are implemented within institutional food service settings. By identifying relevant scientific research of sustainability initiatives that are implemented within institutional food service settings, summarize and disseminate concepts of sustainability initiatives implemented within institutional food service settings, and identifying gaps in current research and scientific literature that would indicate the requirement of further research within these settings to inform the development of sustainable guidelines, policies, and frameworks. This scoping review will follow the guidelines of PRISMA, the extensions for scoping reviews, and following is listed as according to the PRISMA SCR checklist. So we have our protocol and registration, eligibility criteria, information resources and sources, so scientific literature, sources such as grey literature as well, search strategies, so keywords being sustainability, food service, waste, and hospital, selection of sources of evidence, so our inclusion and exclusion criteria, data items, and charting process, critical appraisal of individual sources of evidence, synthesis of results, and our summary of evidence. So this project will undertake the study design of a scoping review rather than a systematic review, as this is a new and emerging area of research where there is limited research to successfully perform a systematic review. This project timeline has an anticipated start date of August 2022 and anticipated completion date of November 2022. To prevent and avoid these risks, a careful design strategy will be followed using multiple databases and sources of literature, carefully selecting the synthesis method based on the data analyzed, and using formal methods to summarize and describe the evidence base. And by being explicit and using high quality guidelines such as the PRISMA SCR checklist mentioned before. Thank you for listening.